Now that we've gained some insights into the efforts and the plans of the public sector, it's now time to hear from the private side. Starting with Ayala Group's AC Health, a brand that's making bold moves towards sustainability. And their mission? To make healthcare accessible, affordable, and high quality for every Filipino. Today, let's hear their perspectives on shaping career paths with sustainability at the core. We are joined by a respected leader in his field. Get this, he is the first Filipino clinical researcher to pass a USD FDA audit and the only Filipino to have served as president of the Asia Pacific Association for the Study of the Liver. Wow, that is a handful. Let's all welcome the medical director of Healthway Cancer Care Hospital, Dr. Jose Joey Sollano. Good morning, sir. Welcome.
Good morning. Thank you very much for this invitation, Manila Bulletin. I'm very happy to share my insights hopefully to the students' perspective. And I titled my talk, Shaping Our Career Paths, Your Career Paths Towards Sustainability as You Shape Your Future Today. Basically, I'm a professor of medicine at the College of Medicine at this campus, and I've been roaming around this campus since 1969. So I am very, very much gold and black. All right. So when I was asked to give this talk, I consulted Copilot, the ChatGPT of Microsoft, to make it easier. And he gave me 4 of these 8 things that I want to speak about to you today. And therefore, I added my personal perspectives, and I hope that I'm speaking to the students, maybe not for these people in front, but for the people who have still black hair. And let us see how we are as a student who is dreaming to be one of the most important people in this country and, of course, in the world. And therefore, when you are going for the people who are wanting to go to medicine or maybe to nutrition, this is all the same. Whether we want to be a teacher or an investigator or a clinician or a scientist, we all want to be what we are, and that is what we want to advise people. Begin with a purpose by what you think you will be better and be contributory to the growth of your families, your society, and of course the country. Because we know that when you have a passion that you have dreamt about and have committed to yourself, then clearly success is just around the corner. This adage that says, allow your passion to become your purpose, and so that will become your profession in the future, is very important. And I think today we talk about sustainability, we talk about sustainability in our families, in the workplace, and of course, in the environment. Always that when you dream, you want to be bigger. We don't want to be smaller. And make sure that you are wanting to be a professional, wanting to be a leader in the big stage. The problem with education in this country is that when our parents tell us, or tell all of us, to go to universities, mag-aaral kang mabuti para magkakatrabaho ka ng maganda. To me, that is a very defeatist attitude. Kasi tayo nag-aaral para mag-imbento, gumawa ng sarili nating hanap buhay, at para tayo ang nagtatanggap ng mga aplikante. Because we are not here to study to become an employee. And hopefully that is a challenge that everyone will be coming home after this talk. And I don't want to belabor the fact that we need to commit to a lifelong learning, all of us. Being a student, being a professional, and being a parent, we all learn every day. But I want to focus on what is the mantra today, research, innovation, and I equalize that and I put that as an equation into versatility. We know that when you do research, when you do innovation, you basically are the leader. And when you are tracking and wanting to create a career, we want always to be one that will be in charge of our life, our destiny. But it is important that you envision your future and you endeavor and work hard to create that future. And of course, creating the future is to be able to stay current. When I was a medical student, I wanted to be a surgeon. But I realized that during my time, I graduated in 77, I thought that, endoscopy was very good because it can access the abdomen, it can access any part of the body that's an orifice, and you can do something there. You don't need to be operated mihiwa. So I did endoscopy, and I thought that endoscopy gave my life, created my career, and now I'm here. And I thought about that when I was still in medical school. And I wanted to become an endoscopist and not a surgeon. So now I'm a surgical endoscopist, basically. I know that there are pharmacists in this room. The role of pharmacists in the future is not really just being there in mercury drug, dispensing drugs, but the future is basically not only primary care, but now there is a trend towards specialty care. There are pharmacists who are able to give drugs and discuss with very, very good expertise among doctors and among peers on how to manage a particular disease in a particular patient. And so the pharmacist of the future, and maybe even the present, is a very empowered pharmacist, not just somebody who follows orders and gives drugs over the counter. And clearly, we also think about the entire community, not only in the local community, but of course, if you're global, you talk about global communities being taken care of by the pharmacist in a sustainable manner. The nursing profession is a challenge. It was challenged during the pandemic, and we thought that between now and the end of the decade, these are the roles of the nurses to maybe look at the remnants of COVID. But clearly, in the future, the role of the nurses are basically to stabilize the workforce. There's always a shortage of nurses. In the U.S., the nurses when you make rounds in the hospitals in the U.S., the nurses are like 45 years old, 50 years old. Ang mga Pilipina lang doon ng mga bata. Sa Pilipinas, walang nurses. Di ba? And there's always a shortage. And therefore, that is part of the role of nursing students to be able to sustain the workforce. And clearly, take care of yourselves. The mental health issues are important, and it is important in the medical profession, in other professions, but clearly in the nursing profession. And being able to balance your career and your life is important. And here are some tips to the ones who are dreaming to be nurses. These are some of the trends about being a nurse in the future, because there's always this whole person care that we want to give to our patients. There are very, very wide areas where you can grow in informatics. And clearly, we want the nurses to be also at par with the doctors that are working, because clearly you are going to be a very important part of the medical care of patients. For the nutritionists who are in this audience, yes, there are very, very important implications, not only in being able to create diets that are sustainable for the patient, that will sustain their life and their quality of existence in their disease states, but clearly there are other areas that you can make contributions so that you can have a diet that is sustainable today without sacrificing the future. And there are also a lot of trends in diet therapy today. This is a mouthful, and I know that these are some of the things that maybe you can read in the internet, but I think I would like to focus on those 2 bullet points at the bottom, because maybe in the Philippine scenario, this is where the nutritionists and dietitians can create some small contributions that can be magnified so that you can be a big player within your communities, but of course clearly in the entire country. Because today there's a lot of food wastage. If you go to McDonald's, they don't allow you to bring home the excess food. It's because they want to have control on pilferage. But clearly, you have control on pilferage, but you're also wasting food because all the remnants of the food every day are just thrown away. Now, in medicine, there's a huge buzz about the microbiome. We know that the concept about germs has changed. There are only bad germs, and we're being taught by our mothers not to eat something that dropped on the floor. But today, there's a concept that there are good germs and bad germs. Therefore, the good germs helps your immunity, digest the food to become vitamins, and the bad germs, of course, give you disease, obesity, and maybe even mental illness. And today, there's one of the most exciting part about medicine today is fecal microbiota transplantation, meaning that I can cure a patient by giving the stool of a very, very healthy patient to a sick patient. Okay, so don't be kadiri now. We're able to deliver that very decently, and I'm sorry that the ASIC of DOH is gone, because we have been applying for a license for fecal microbiota transplantation in this country for the last 2 years, and we never had an approval at all. So dito may problema ang Department of Health, no? Kasi wala silang masyadong proactive attitude towards science and advancement. But yes, there is fecal microbiota transplantation, very good for infections, very good for even autism, and very good promise for cancer therapy. And that is research that you can do when you grow. Today, therefore, there is a new concept about germs. Before, it was a cause of illness. Today, it might be the medicine for the future. Now, when we say research and innovation, as I said, when I was a young medical student, I was trying to create my future. And along the way, I was an endoscopist, and I studied the liver. And then now I'm doing IBD, which is a rare disease in this country. And that made me malleable and versatile. And as I grow older, I was still relevant, because that is the way I would like to be as I grow old. And therefore, when you do research about your future, about what you can do in the future, not only in 2030, but maybe for your class, maybe until 2080, then you have to do research so that you will be in the forefront of what you want to be starting today. This is my life. This is my biodata. So I was a teacher. I was a researcher. I was president of many organizations. And of course, at the end, you are rewarded. But what I'm trying to tell you is that you have to grow and mold and morph into something that is important within your specialty, but of course also in your community and of course in the country. But I always tell I have my young student here, Dr. Dane Lucero. He's a fellow trained to be a gastroenterologist. And clearly all of us wants to compete. But I live by these rules. If you want to compete according to the rules. And so the best way to do that is adapt a sport. Pag foul ka, foul ka. Pag out of bounds ka, out of bounds ka. Hindi ka tulad ng competition in the house. Kung sip-sip ka sa tatay mo, walang rules, di ba? So we don't want to do that. We don't want that model to be you to be as well competing in your workplace in the future. Now, as I said, research is important. All of us in the university are taught about the truth. When you are going to work, you are working and creating truths. You are also investigating about truths. And how do you do that? Research. You want to understand how peptic ulcer is produced. What is the truth about peptic ulcer? You do research. And research can propel you to become an important person in your communities. I am part of this crowd here in the UST that just came out from the varsitarian. And I am very proud to say that all these people, medyo nerdy na konti, pero at least meron silang pinagtandaan. All right? And we hope that all of you becomes part of this research environment in this university, because that is the essence of the university. This is one of my research papers that was published in the New England Journal of Medicine years ago. And I am quite proud of this, because this drug for hepatitis B, which is still the drug today for hepatitis B, I was part of the development of this drug from the very beginning. And then, of course, you are rewarded. We published a guideline for treating IBD during the COVID times. And this is a very, very important paper, because this was awarded as a top-cited article in the publications that is in gastroenterology. Of course, that is a nice certificate, but what is exciting is the day that you receive the email that, yes, you are one of those recognized. And this is one way of telling yourself in private that, man, you have made some contribution. And that is one dream that I would like you to realize, so that you will have to be a very, very engaged individual, not only today, but of course shaping your future. Now, in academia, when I was in India, I go to India a lot because I'm invited to speak there and I have a lot of colleagues. Akala niyo pulubing India? No. India is a very progressive country because there are a lot of people who are doing PhDs and doing a lot of research. And so if there is a very high respect for the Indian professionals, it's because of their engagement in academia. And what does academia do? We do research and we publish. In medicine and of course in science, we say you either publish or perish. The problem in the Philippines is that publishing and researching is not sexy, and therefore we need you to be engaged in research. Please, if there's a chance that you can do research, you do that because that is the investigation of the truth. It is not the truth that you get from your teachers, but it is the truth that you can contribute to the world so that your teachers will also be learning from you. Now, everyone wants to be immortalized, and this is some lessons that we tell people. To be immortal, you sire your son, plant a tree, or write a book. And by publishing, you basically wrote a book. In the Philippines, we have published this internal medicine textbook because we thought that maybe this is an important contribution that all of us can make. Until today, most of the medical books are written by foreigners, which is really crazy. So at least in the internal medicine community, we have written some textbooks for the Philippines. Now, that is why I have my fellow here with me, because I want her to be learning from this talk, because now she's a trainee, but soon she will be a teacher, and soon she will be a mentor. Becoming a mentor and becoming an unselfish mentor so that you will be able to create clones of yourself who are much better than you is one way to become a very relevant individual and maybe also a very, very important father. So what we do today is create training programs so that people who are ambitious, who are talented, will be able to take care of ourselves, their teachers, and of course, the future of this country. I am always a believer in developing people. And when you develop people, you don't teach them, but you make sure that you empower them and then allow them to grow. There's this terminology called professional abortionists. These are people who are mentors trying to develop young people to become like them, but towards the end, they drop them. They don't want them to be part of their own specialty. In Healthway, for example, we want to welcome young people to be part of the team who are going to develop and treat cancer patients in the Philippines, because I think this is the way to go. The mentors and the students come together and start an environment of cooperation. Now, the fifth message that co-pilot told me is that to be able to be sustainable, you have to adopt a leadership role so that you'll be able to create change. But the most important is that you're only able to create change if you are also the epitome of that change. You are open, you are going to be cooperative, you have communication savvy, so that you'll be able to convince people and persuade them to be like you, to be better than you. In my profession, for example, I have been very noisy about IBD, and to me this is something that I am very proud of. Since coming back from training in 1990, I came back in 1988, and I thought that this intestinal disease called tuberculosis of the intestines was a disease that was taught to us to be present in the Philippines, and of course amoeba. When I was training abroad, they were calling it Crohn's disease and ulcerative colitis. When I was a student, my teachers tell me they don't happen in the Filipinos. They only happen among the Jewish population. But when I was in Japan, I was seeing diseases that I thought was TB, but the Japanese professor was saying, oh, this is Crohn's disease. So when I came back, I said, I want to change the paradigm and tell people that there is Crohn's disease and ulcerative colitis in this country, and so I formed the IBD Club of the Philippines. And today, I'm very proud to say that all the younger people or the younger medical students in this country believe that there is Crohn's disease and ulcerative colitis in the Philippines. Nung nagsisimula ako noong 1990, sabi nila, Joey, bayaan mo yan, TB lang yan, saka amoeba lang yan. Today, we are seeing patients and we are helping patients to be treated of this malady that creates holes in their vagina, creates holes in their bladders, and connects to the rectum. So very, very complicated disease, and therefore, we are able to help patients. And this is what I call advocacy. Advocacy, of course, is a crazy mantra for some young people like you, but as you grow older, you will see that you can create change by being an advocate. Now, I don't want to talk about ambition and balancing with health because all of us want to be healthy. I must only advise everyone that everyone who's overweight in this room needs to shape up because a big belly brings a lot of diseases. But I want to end my talk with these last two items by giving you an example of how you can be a globally important individual by acting locally. I want to share with you the experience of my colleagues in Egypt. When the drug sofosbuvir was invented, it was the cure for hepatitis C. The treatment for hepatitis C before was interferon, which is a very expensive drug. Now it is a tablet. You can take it for, and then with interferon, you get treated for a year with injections, spend maybe $500,000, and the cure rate is only about 60%. Today, the drug sofosbuvir can cure you in 3 months, and it's a pill. And so what my friends in Egypt did was create a national movement to control hepatitis C because Egypt has one of the highest population of hepatitis C. And today, look at the graph. In 1 decade, they have almost eradicated hepatitis C in Egypt, and now they're a model for the world. So the Egyptians acted locally, and now they're a global hero. And therefore, I want you to be one of those, to be wanting always to look for areas where you can become a local hero and become a global person. Now, for the pharmacists in this room, I think this is what you do today. As I said, you are part of the multidisciplinary team who manages patients today. Your opinions are respected by colleagues like the doctors, the medtechs, the surgeons in the team. But clearly, you are going to be influential, and you are encouraged to be influential and become a vocal member of the team. Kanina tinatanong ni Asik Domingo, sino dito ang taga medtech? Parang walang imik, no? Ganun ang taga-USD, hindi nagsasalita, no? So become vocal. May isang kaibigan ako dito, taga-Ateneo. Yung mga taga-Ateneo, medyo magaling magsalita. Ganyan dapat tayo. Di ba? So, sa USD, medyo matahimik ang mga estudyante, even in medical school. So I want you to become a little bit more vocal, create this capacity to communicate so that you become more an effective and relevant leader that you want to be. Because there is a role for acting locally, and of course there's a role for acting globally. For the nutritionists in this room, I'm glad that there is this college that is dedicated for that profession here, and some of you are here. These are some models in the UK that I want you to be reading. But clearly, in the local setting, we want you to devise diets that are made of Philippine vegetables and products that are available here so that we can feed and treat and nourish Filipino kids and elderly patients in a very sustainable manner because we are using our local products. Now, clearly for the nursing students who are here, these are the challenges of the future for nursing. Make sure that you are going to be very, very caring personally as a human being, because if you're not very careful, the robots will take over your profession. Sa Singapore, meron na nagsaserve na mga waiter na robots. Mag-order ka ng tubig sa concierge, a robot will come to your room in China. Okay? So hindi tayo pwedeng mahuli doon. Now, most of all, most important is that I think everyone misses the point that all of us are part of building this nation. The nutritionists, the pharmacists, the medtechs, the medical students are part of nation building. It's not only the government who builds nations. We are supposed to be the builders of this nation. And therefore, I want that to be remembered by this group of students today here. And lastly, of course, is by becoming focused in your activities of your profession, of your ambition, being fulfilled in the workplace, you create a legacy. All right? And these are people who have had their names etched in history because they have created so much impact in society, of course, and of course in the lives of people. In my personal view, I think being able to introduce IBD in this country as an accepted disease that is now being studied and we are treating people and helping patients is one of the things that I am very, very proud to leave before I go. In Healthway, of course, as you have heard it, we are the first cancer-dedicated hospital in this country. And we are wanting to create a new system, a disruptive system, so that we'll be able to make cancer care a very comprehensive approach to treating patients with a very, very bad and life-threatening malady at an affordable cost. And with leaders like these who are in the pictures, who are very, very avant-garde in their ideas about how to deliver affordable health care in a national scale, we hope that we'll be able to also create a legacy for the country, and of course, hopefully for the region, and of course, for the world. So, when you are going to therefore look for idols so that they can become your role models as you grow older in your chosen careers, in your chosen profession, look for people who have had an impact, create and read about their history, and maybe copy or emulate them and modify them a little bit so that they can be adaptable to your resources, to your philosophies, and hopefully that in the future you also become one of those. As I've always said, I have very, very simple life rules. I live a good life, I thought, or I think. I have my family and I love them. Your family is your most important friends. Whatever you do to your kids will always be what you will be in the past, and of course what you will be in the future. And hopefully you'll enjoy your life and maybe create a legacy. So if you're looking for people to emulate and to copy, listen to the people who have good dreams. Look at the people who have formed a life that is worth emulating, and make sure that they become part of what you are, so that in the future you can live your dreams. Thank you very much for your attention.
All right. Thank you very much, Dr. Sollano. We will see you again later at the panel discussion.